I would check my blood sugars, and no matter what I did, I was not able to get it just all of a sudden, you're on your normal meds, and I was following what the doctors did. I may not have been checking as much as I should. Then all of a sudden I'm checking, and I'm like, these numbers are huge and a lot more than I should be. So these are, diabetic, when you're above 120, you got to start, worrying about it. And I was getting in the 200s, close to 300, and that's with meds. And so I knew that something had changed my body. And so it started getting alarming. I started watching that more and seeing what I was eating and doing, and my numbers weren't really reducing all that much. So that's where I thought I needed to make a big change. He just has a different approach, really analyzing getting a lot of blood tests and a lot of different tests that are out there, but he can order those and look at the numbers, and so it's nutritional. He's just, in general nutrition, he balances you out. So I think it was very good timing on this. I had vitamin D deficiencies, I had other deficiencies, and now those are all very great, and I think it's actually helped through this stage. My normal physician, she would say that, yeah, you need to watch your diet and all that, and they would direct you towards a dietitian, and it was cookie cutter. It wasn't really tailored to me. I was just saying what a diabetic should eat, which is not. In reality, what we found is I had other sensitivities to other types of foods that were still under within the dietitian that it should be, for a doctor. But those foods were actually boosting my sugars up. So it's just he knew the finite details of what I should and should not eat through these various tests, which was really exciting. I think it's just a different look. I want to have definitely a longer life and a good life as far as mobility and all that. So I knew that if I was going to continue down that road, I was going to have to start taking higher doses of medication, go the normal, physician route. I just knew it wasn't the right way. It just wasn't going to control. All it was going to do was just try to make it steady. It wasn't going to improve me in any way. So I know I needed to go a different route. Every single person is different, and he boils it down to, what kind of things cause inflammation, and if that inflammation increases your blood sugar. So it's not only just because you're not receptive to different foods. It's you have actual insensitivities to it. So that's what drives your sugar up. I went from an A1C of almost a 12. And now I'm down to a 6.8, I think my last reading was. So it's almost in half, which is a huge, huge amount for a diabetic. And still working on it. So I'm not out of the woods yet, but yeah, still working on it.